Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us again.
Well, thank you once again for having me on this program.
Yes, sir. I know that the budget has been passed, but I wanted to speak to you on that, and specifically during the budget debate, you had spoken about the pediatric cardiac surgeries. So, firstly, if we can start by how many children have been sent in recent times to do a surgery of that nature?
Well, this specific program that we want to restart, we want to restart it because we have quite a number of children who were diagnosed with various cardiac pathologies that require surgery. And we have stopped that program in Guyana. We had it a couple of years ago, where we had a team of overseas doctors would come in at least once a year, and they would work along with the local staff here to do those surgeries. So we built capacity, and we were able to do some amount of surgery here. And then a couple of years ago, that program was stopped, which led to a backlog of patients. And of course, if you have to do a surgery like this in America or Canada, it's a very expensive surgery. So, for example, it would cost maybe between $30,000 to $50,000 US per patient to do these surgeries in the US or Canada. Over the last 2 years or so, we were only able to send maybe about 5 children. 1 went to the United States, 4 went to Cuba. Of the 4 that went to Cuba, I think one of the patients, while they had a very successful surgery, one of them died. So that has been challenging both for the parents, obviously, and all of us. So it is a challenge for us to really pay. It would cost us more in the long run to try to pay for these surgeries and send children abroad, rather than being able to do those cases here, do those surgeries here. So I have, over the last couple of months, I've been talking to the cardiac team that was here before and that was performing these surgeries. And they have agreed to come back to Guyana starting this year. They would have to make an appraisal of the types of equipment that we currently have at the Georgetown Public Hospital. We'll have to buy a lot of the equipment and bring it in. And then by the end of the year, we'll be able to bring in a specialist team to be able to do the cardiac surgery. We're expecting that this year, more closer to the end of the year, that we'll be able to do at least 20 cases, and hopefully that would bring relief to these children. We think we have about 130 such cases that we need to do, so there's a backlog. And we'll work to see how we can make sure that every child who needs cardiac surgery would be able to get cardiac surgery right here at the GPHC. In addition to that, this year we're looking at building, well, not building, but designing a maternal and children's hospital. So we have been in discussions with a bilateral partner to be able to develop this particular facility. And when it's fully developed, the specialized programs like these cardiac programs and so forth would become part of the services that would be offered by this hospital. So we are starting some of these specializations in the GPHC, but later on, as in the case with children, we will migrate them out to the specialized hospital that we'll be developing.
All right. As you mentioned, migrate them out. I just, for clarity, it would be separate and apart from GPHC.
Yes, it would be. Yeah.
All right. And I wanted clarity as well. It's a government service, but we know it's a very expensive service. So at some point, I know government will probably take up some of the cost, but would there be a paying factor? I don't know. Can you?
At this point, the specialized services that we want to offer, it's not envisaged that the patient would have to pay for it at this point in our discussion and the development of the project. So we don't envisage that patients would have to pay. So we'll see how that goes as we develop it, we finance it, and we have to operationalize it.
All right. Minister Anthony, since you came into office, you've had to deal with the COVID-19 pandemic, and on a daily basis, I don't know how many other things that you've had to deal with because the health sector is wide. And I sense the passion behind why this was necessary. I just wanted you to share that with us. How important was it for you to restart this particular type of surgery?
Well, there are lots of things to be done, obviously, in the health sector. We really need to get some of these services going. This one, in terms of pediatric cardiac surgery, these things we can really prevent children from dying. And we have over the years been able to work with a number of great doctors to be able to put this program together. And it was sad to see that the program was dismantled. So we are now putting that back together because we have seen the tremendous benefits it will bring to these patients. Obviously, it's saving their lives. If you don't operate in a timely manner and the children get too old, it becomes even more complicated and difficult. So there's a window, a time period in which these surgeries must be done, and if it's not done, then it's very, very challenging. So for those children who were affected by these illnesses, we really want to provide that service. We have done so in the past. We have nurses and some of the local doctors that have benefited from some of the training. And we think that by bringing them back together, it would be easy to put together this program again. There are many, many areas in health that we have to rebuild those programs because for whatever reason they were neglected. And when they were dismantled, it really affected a lot of people. And of course, there are new areas that we want to get into. So you would see while we are rebuilding some of the older programs that would benefit people, we are also going into new areas where we have previously not been able to roll out programs in. But there's a need. And so one particular area in this budget is the area of chronic non-communicable diseases. We have created an 8th program in the ministry. Previously we had 7 programs, so now we have an 8th, and that 8th has singled out chronic non-communicable diseases. And over the next couple of years you would see that growing because the causes of illnesses and deaths, most of it can be attributed to chronic non-communicable diseases. So we have to develop national programs and then integrate it across the system to make sure that we are able to prevent, in a lot of cases, some of these diseases from developing. But if they do develop, that we are able to then minimize their impact by providing early care, making the diagnosis and preventing complications from happening. So a lot of emphasis this year would be placed on each of these major types of diseases, and we would develop at the appropriate time, special plans and programs to be able to roll back some of these diseases or minimize their impact. So already we have in train developments to look at the cardiovascular diseases, and we are going to be partnering with the Pan American Health Organization to roll out a program called HEARTS. This program is intended to reduce the cardiovascular diseases in the country, and we would start by working to reduce the risk factors for these diseases, and of course aligning the health system to make sure that we are able to provide prevention and treatment so that we can reduce the amount of people that are going to be affected by these diseases. We are also in partnership with a number of international organizations to develop a cancer plan, and our focus this year would be primarily on prostate cancer for men, and we are going to look at breast cancer and cervical cancer in women. And under the rubric of this overall cancer plan, we would then have specialized plans, if you like, to deal with each of these areas. So cervical cancer, breast cancer, prostate cancer, and so forth. And there are general things that we have to do to improve, so including chemotherapy and how that is being administered and people being trained to be able to do that, radiotherapy to improve what we're doing right now and to be able to have better equipment and so forth so that people can benefit from these things. And to look at other ways of preventing cancers. So there is a comprehensive plan that is being worked upon, and I'm very optimistic that shortly not only would we have the plan, but we'll start putting the resources to make sure that the plans can be adequately rolled out, and therefore reducing the burden of cancers in Guyana. And of course, there are other areas that we're looking at. So chronic non-communicable diseases are not just about cancers, but there are other areas. We have some dedicated plans that we're looking at for diabetes. One of the new features this year that we'll be working on is to develop a one-stop center where a diabetic patient can come in, and once you come there, you will be seen by a doctor, you can be seen by a nutritionist who would give you advice on your diet. You have to get checkup for your eyes. There would be a place there that you can get those services. You have to check your feet. There would be a place there that would check your feet to make sure that you don't have ulcers or ulcerations. So basically all the things that you would need to care for a diabetic patient would be available in that one building. And we think that that would improve the quality of care that we will be offering, and hopefully people would become more compliant. So it is not just a fragmented care where you get some medicines, you drink them, and you ignore your nutrition, or you don't understand fully how to manage your diabetes. So you get diabetic education, you will get the information pertaining to your diet and nutrition. All of that would be available in that one space. So literally you can move from room to room and be educated about your illness and how to better manage it. And we are confident that this model is going to work because we have seen it work in other countries of the world, and those who have implemented this model and utilize it, we have seen that they have been able to have better control over their diabetic patients. We have seen the glucose levels go down, people have less complications, and so forth. So that's something that we are going to start. We are building the first such center this year. We have an allocation in our budget to start building that center, and hopefully we can get that completed by the end of the year so that we can start this program perhaps early next year. So there are many exciting things in the budget.
Thank you for that. I wanted to address training, but I'll leave that for another day because I know we have a whole long list to go through. But I wanted to talk to you about the Sino-Farm vaccine. It is the vaccine that we have gotten recently, and what is happening, how many have been administered, and so on.
So we've just received the Sino-Farm Vaccine, and as you know, this is one of the effective vaccines that are around. The efficacy, as we have seen from the scientific literature, is about 79.4%, which is really good. And it means that if somebody receives the vaccine, that it would prevent them from getting the disease. If they do, however, because there's still that small percentage of chance that they can get the disease, but if they do get the disease, if they do get infected, then it would be in a milder way, and you wouldn't, in most cases, all the studies have shown that you don't get the severe form, meaning that you'll be ending up in the hospital and having to go into the ICU and so forth. And I think that's a great thing. So these vaccines are very, very effective. They have been used in a number of countries around the world, especially in the Middle East. Many of these countries have taken it. And there are several countries in South America that has given it emergency use authorization. I think we were very lucky to be able to get these vaccines because now the Chinese government, they're trying to immunize their population, so there is a little scarcity because you can imagine they have a very large population, and there's some level of scarcity in terms of balancing what they will give to their domestic market and being able to share some of that with the rest of the world. We're grateful to the government and people of China for this donation. We are the first country in the Caribbean to receive this donation, and we are extremely thankful to them. With these 20,000 doses, we'll be able to immunize 10,000 persons in Guyana. And as you know, we are offering the first set of people to benefit from these vaccines are our healthcare workers, and so we are offering it to our healthcare staff. We have because it's a new vaccine, we've had some experience with the AstraZeneca one, and we know how to use that. This one, we have all the information, but out of an abundance of caution, we went back and we trained our healthcare workers how to administer this particular vaccine. And we had to develop some information, booklets, that when someone come to get the vaccine, that they are also receiving information booklet that explains to them the vaccine, how it works, what are the possible side effects, who can get it, who cannot get it, and things like that. So we had to develop that. So over the weekend, we are going to start using this particular vaccine to roll it out to people.
All right, Minister, thank you so much for that, and that's a wrap with us for today. I know it's been a busy week for you in the Parliament, so we thank you very much for taking the time to speak to us every day.
Okay.
All right, well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. For more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.